So a tummy tuck is great for tightening excess loose skin, and it's also great for tightening the ab muscles. So all of us have a pair of ab muscles that run down the front or center of the abdomen, and with certain conditions like pregnancy or weight gain, they can become separated. And after pregnancy or after weight loss, they do go back towards the center to some degree, but they don't always fully return to where they were. So there are a bunch of different ways to repair the ab muscles, and my preferred technique is using 2 layers of sutures. And the first layer is one that I place deeper, and that one I do a bunch of interrupted stitches. So say if someone was doing a sit-up or they did an activity maybe a little too early and they were able to pop one of the stitches, the entire length of the repair wouldn't fall apart because we've only affected one stitch and there's an entire row of separate stitches. So, and then the second layer I put is a running layer. So it's a single continuous layer from top to bottom, and that way you have a double reinforcement to that repair. The main reason a tummy tuck is recommended over liposuction, for example, is if you have loose skin. Loose skin, even though it might get a little bit tighter after liposuction, that procedure alone is not meant for skin tightening, whereas a tummy tuck is meant for skin tightening. So when it comes to how long the tummy tuck scar will be, it really depends on how much loose skin do you have. So if you only have a little bit of loose skin and it's just along the lowest part of the abdomen, you can actually do what's called a mini tummy tuck. And if you have more skin, and most people don't have loose skin just along the center lower abdomen, they have it upper and lower abdomen, which is pretty normal. And in that case, the best procedure is a full tummy tuck. There's a smaller category of patients who they don't have a lot of loose skin per se, but they do have some that's on the upper and lower abdomen. And so for those patients, they can do what's called a short scar tummy tuck, where the scar itself may be shorter, but they're still getting the full benefit internally. And by that I mean we're still doing the full muscle tightening from top to bottom. Say you really need a full tummy tuck and instead you really want a mini tummy tuck. There's a couple reasons why that's not a good idea. One of them is if you tighten just the lower abdomen, which is what a mini tummy tuck is, the upper abdomen, even if it was only a little bit loose before, it'll now look looser because it's now sitting next to a tightened area of skin. So it won't look cohesive, or it'll almost look like patchwork, the upper part looking a little loose and the bottom part looking tight. The other problem with doing a mini tummy tuck in someone who really needs a full tummy tuck is that incision will be inadequate. Like, it won't be long enough to take out the amount of skin that you need to take out, and what that means is it ends up looking kind of pleated or puckered on the sides. Even though the results of a tummy tuck last because it's a permanent reduction in skin in that area, you can stretch the newly tightened skin, so you still want to be really good about diet and exercise, and just remember that patient participation is actually required to maintain those results.